Welcome to the early onset survivorship panel discussion titled Beyond Survival, exploring the psychosocial mental well-being of cancer survivors in the state of Connecticut. This is our first speaker series or panelist series. I am Dr. Wendy Garvin-Mayo. I am the chair of the Early Onset Survivorship Working Group, and I'll be your facilitator for today. Today, we are joined by an amazing panel with a wealth of experience and unique insights. And we are really going to dive into their insights on the cancer survivorship journey for our survivors in the state of Connecticut. So, we're going to look at psychosocial support along with the personal experience from a cancer survivor. We're going to look at how social work is built into that, as well as the clinical oncologist. And then we have our patient navigator, Zarek. So before we go any further, brief introductions of our panelists. First, we have Tracy Frazier. She is a breast cancer survivor, and she will share her personal experiences and perspectives. Then we have Tammy Black, who's a social worker and a clinical program manager at Cancer Support Community, bringing expertise in emotional support and community resources. We have Zarek Mena, who's a financial patient navigator at Share Cancer Support, who supports patients, help patients navigate financial complexities of their cancer journey and much more. I'm sure it's just not financial. And then we have Dr. Neil Fishback, who's a medical oncologist at Smilo Cancer Hospital, and he focuses on breast cancer, offering insights from his work supporting patients' holistic well-being. Together, we'll explore the challenges and resources that shape the mental health journey of cancer survivors. So, thank you for being here, and let's get started. So, first, we're going to talk about the emotional and psychological challenges for cancer survivors in Connecticut. And I'm going to start with Tracy. Tracy, as a cancer survivor, you've experienced firsthand the ups and downs of cancer treatment and the journey that follows. Um, what would be your biggest emotional challenge you faced during and after treatment as a survivor?
Um, the depression, I know I always struggled with depression, except in the fact that I did have this diagnosis, and trying to figure out how I'm gonna continue to live my life, knowing that there is not 100% cure for it, but still trying to find happiness in the midst of that and living. So that is my what I experience.
Yeah, thank you so much for that. And Dr. Fishback, as an oncology provider, I'm also an oncology provider as well. We play a crucial role in supporting patients during treatment and really trying to address their psychological and the social impact of cancer and cancer treatment. What are some common challenges, psychological challenges you see in cancer survivors post treatment? And then how do you approach this conversation talking about mental health post cancer treatment?
Well, first of all, Wedding, thanks for having me. It's a pleasure to be with everybody today. Uh, Tracy, I think you brought up one of the key points, right? That cancer doesn't happen in a vacuum. It's often layered on top of other stresses and strains in our life, and including mental health challenges. And in fact, sometimes I find that cancer is the easy part. Thanks for that really critical observation. Um, I think the main challenges that I see in people who have whose lives have intersected with cancer is that cancer changes us, and we're a different person after. And how do those changes not only affect us, but those we live with? Cancer is an enormous stress on our interpersonal relationships. It can bring people together, but it can explode families and relationships. And I find that to be one of the biggest challenges that I encounter in people living with cancer. In terms of the kinds of things that are germane to the cancer experience and survivorship, I think fear of recurrence is way up towards the top. Just as you said, Tracy, how do you live with this concern that cure may not be 100%? And then the other really profound thing you said, how do you find joy and meaning when your life has intersected with this cancer. I think that's particularly true for people who may be living with metastatic or stage 4 cancer. Is how do we do that? So those are the main challenges, and I know we have this amazing panel to help flush out how do we address these things, because in the space of my 15-minute encounter, it is often very difficult. And building a team and relying on the whole support staff, I think, is a critical piece.
Yeah, absolutely. And sometimes it starts with the clinician to make the connection for the patients, for us to connect them with someone like Tammy, who I'm going to go to next. Tammy, how do you help young people grapple with the emotional issues that arise from after their cancer treatment?
Hi, everyone. Thanks for having me. So really one of the first things, quite frankly, seems somewhat simple, but it's really not, is to validate and normalize what the person sitting across from me is feeling, right? So oftentimes, addressing the emotional and psychological issues that young survivors are dealing with is so necessary for the ability to, like Dr. Fishbeck just said, finding joy and happiness in our lives moving forward, right? So first, right off the bat, is really just providing that I see you and this, I can appreciate what you're experiencing, and this is hard. And just allowing that, providing that safe space to talk about that. Really talking, also exploring coping strategies. How am I going to, right, deal with this? What coping strategies do I already employ? What are some that I'd like to tap into? Meditation, for example, mindfulness, excuse me, tapping into, one-to-one therapeutic sessions with a clinician like myself, or so, there are so many available today. Really just exploring in a safe place how you're feeling, what coping mechanisms are working for you, setting goals, talking about the future. What are realistic, healthy goals that I can set for myself, giving me something to look forward to, working toward. So those are a couple of ways that we really want to hone in on and help our younger survivors.
Yeah, thank you for that. And I know Dr. Fishback mentioned the fear of reoccurrence is really high. Are you seeing the same thing in your practice?
The fear of recurrent, yes. How to move forward, right? How do I move forward? How, talking with other, support groups are a great way for people who are young, for, whatever the population, who are fearful. What if this, what if this comes back? Or how am I going to handle that? So really managing having one foot in light, right? And then how do you manage the fear holding you back? And that's why that goal setting and exploring around the goal setting is so important.
Yes, thank you for that. And I want to kind of move into support systems and resources. So, Merrick, patient navigators play an essential role in guiding patients through complex systems and connecting them with the right resources. What does a patient navigator do? Because many people may not have heard of a patient navigator. So, what do they do really to help survivors like reintegrate into their post-life treatment as survivors? Like, what role do you play? How do people get connected with a patient navigator? If you can just speak to that.
Yeah, definitely. Thank you so much for having me. So patient navigation is an evolving field. It's comprised formally of three types of navigation: patient navigation, which are non-clinical, nurse navigation, and social work navigation. I do work nationally on many boards and such, and we're trying to really hone in on even specialties like digital navigation, clinical trial navigation, and it really can dissect it. I myself have formalized into financial navigation. So as you can imagine, all the complexities that a survivor experiences there is a plethora of things that we can do. Essentially, all of us, we're a bridge. We're a bridge to resources, to programs, back to your practitioners, back to the community. And our goal is to find these resources, find the resources, remove those barriers, whichever specialty is most appropriate for the needs that they have at that very moment. Sometimes for mental health, it's appropriate for a social worker. And then maybe it's fatigue, and that's where the mental health distress is coming from, and that would be a nurse navigator. So we always kind of take the lead from our clinicians, like Dr. Fishback, to connect you to a navigator. How do you connect to a navigator? Well, it's being that squeaky wheel, being an advocate. And in those instances where you're not, your healthcare team should be advocating for you and finding us. There are many throughout the healthcare system, and also many throughout many non-for-profit organizations. So we're here and we're ready to serve, but we are of the community, for the community. We represent our community, and that's what makes us so effective.
Nice. I love that. And in order to interact with a navigator, do you need to have health insurance?
No, there is a movement for health insurance coverage recently. So there is now PIN services for this to be a covered service. However, currently, as it sits in Connecticut and in most of our healthcare institutions, it is usually philanthropy that helps cover the cost. And again, there's a lot of non-for-profits. I'm with Share Cancer Support, and we do this as no cost. If someone just calls our helpline and says they need help, they get connected to a patient navigator. And remember, navigation comes in many forms. There could even be peer navigators, right, where they're survivors. So it's a matter of getting connected. And once you are really finding that and having open communication with your healthcare team to say, this is what I need, and we'll find them for you.
Yeah, no, that's good because I know with mental health in general, cost can definitely be a barrier because people aren't just aware if they have insurance, if insurance is covered, especially with a lot of mental health providers now not accepting insurance. It's like cash based. So there's a lot there. So thank you so much for the work you're doing.
Thank you.
Tracy, I want to go back to you. So support systems can be really profound in your cancer journey, even, in survivorship. So reflecting on your experiences, tell us what resources or support systems did you find most helpful in managing your overall mental well-being?
Well,
If you have found any.
right. So I was going through my treatments during the pandemic. So I did have a social worker, but when I was trying to explain to her the things that I needed, the help that I was seeking, she wasn't very effective. So
Mm.
just recently, as of my doctor's appointment on the 7th, I reconnected with social work. So basically, I handled a lot of everything on my own. And soon after my treatment, I went right back to work because I had to keep a roof over my head and take care of my son. But yeah, I wish it would have been easier to have someone else and know of programs that are available to breast cancer patients, but I didn't know anything about it.
Yeah, that's a great point you bring up, Tracy, because in the field I see like it's a separation between like Dr. Fishback and clinical, kind of doing the clinical things. And Yale, you're doing an amazing job, by the way, which I know you're going to talk about, but it's clinical, and then really, having awareness of what resources that someone like Zurich, right, her organization, this nonprofit, there's so many organizations out there, as well as Tammy's, who's doing all this great things, but how do we connect the patient to those resources from the clinic? And I would love Dr. Fishback to kind of get in there to let us know, what can healthcare professionals do to address mental health needs in cancer survivors? And what steps do you think we can take to better support the mental health of our survivors in Connecticut?
Yeah. Wow. Well, that Tracy has brought up some just amazing points. Well, first, as Tammy brought up, normalizing discussions about mental health and making that a priority and a safe space in encounters is important. It always strikes me how personal this is. Zara came to my office the other day to explain to me what her navigation does. Mind blown stuff that this is available. We have a number of resources available to us as part of a large health system, but still it's kind of up to every investigator, not every investigator, every doc provider to just make your own list, have some resources. I think this is what one of the great accomplishments of the Connecticut Cancer Alliance will be, is plugging us all together. There are a tremendous number of resources, Tracy. It kind of breaks my heart to hear that you were kind of trying to figure it out yourself. What services are available for my kids, for me, for my mental health? How do I get my utilities not to be shut off? So I think that each provider making it their priority to assemble a list of resources, pre-printed materials. What a value! Just something as simple as, here's a list of 10 people that we can call, and Zarek dropped off a bunch of her flyers, which are really useful, but those can be really helpful. I practice an environment where I can make an easy referral to navigators. But I think that this is something, Jermaine, navigators are something that are now widely available. You just need to know where to find them. And then remembering that, in my mind, that mental and physical health are directly related. So again, making time to ask about encouraging healthy behaviors. Are people getting enough to eat, sleep? Do they have a place to exercise? Those sorts of things.
Yeah, no, that's good. Tammy, do you have anything to add there? What can we do better?
Well, Tracy, I'm just listening to you, between the mix of COVID and feeling so isolated as people do, you could live in a house filled with people, and a cancer diagnosis automatically makes you feel isolated. So, and then, my goodness, COVID, right? I just do want to point out, there's so much available. Something people don't realize is that all of our services are free. And something people, there are services out there that are free. So quite frankly, you could, in the world of virtual services or in person, now that people are dipping their toes back into being around each other again, right? You could tap into support groups for free. And there's so many organizations, not just our own, right? But, individual counseling. I'm, a 25, I've been doing this for 25 years. And to be able to provide my services for free for people impacted by cancer, whether it's someone living with cancer, someone caring for someone with cancer, kids, teens, right? So there's so much out there. And I think Dr. Fishback speaks to that list that all of, we have these favorites in our back pocket. Oh, you're going to be perfect for, this is a perfect match for you. To make yourself, even as a practitioner, aware of what's out there, or maybe the ones in your list, aren't so dynamic anymore, things change. So really keeping, in the loop, things like this, just professionally, are helpful for me sitting here today as a panelist, picking up tidbits, right? So, really, so we can offer our clients and patients services that are a perfect match, because there's so much out there, but we just don't know what we don't know. So coming together and swapping stories, swapping resources is the way to do it.
Yeah, absolutely. Thank you for that answer. And Tracy, I want to kind of go back to you kind of in the same vein of resources and support, undergoing a cancer treatment, even post-treatment, relationships are definitely impacted by, just your experience, what you're able to do, what you're not able to do. Can you tell us how your personal relationships have evolved as a survivor in terms of relationships with maybe your loved ones, your children, your intimate relationships, just relationships across the board, how those have kind of shifted as a cancer survivor?
Well, I found that with Sisters Journeys, I am going to say Sisters Journeys has been my backbone. And I'm so thankful to meet amazing women, a part of that support group. As far as like my personal life, I realized that me and my older sister got closer. Me and my mom were more of estranged. and me and my fiance became more of estranged. Not sure why. Maybe because I needed more attention, or I wanted more affection or more understanding, but that was definitely a struggle that I encountered during my treatment, even post-treatment. So I just stayed to myself. I don't know.
Yeah, yeah. I'm sorry to hear that shift when you feel like you need the most support. It's not there. But thank you for being so open and really sharing your experiences. And I would love to go to Dr. Fishback. Just talking about, intimacy is a big thing for cancer survivors. As healthcare professionals, we know the impact of a cancer diagnosis and treatment, just on sexuality and intimacy, which is a important part of overall well-being. Um, how can we talk to patients about intimacy, feeling connected to their spouse, their loved one, and getting them connected with the right resources?
Yeah. So being a male practitioner in the breast cancer field is a big obstacle for me that I have to take really conscious steps to get around. And part of that is just naming it and starting a visit talking about vaginal dryness, discomfort. That's a good segue into how is your sex life. Tracy made some really profound points. I have seen more relationships blow up than come together. I think Lizzo's line of "Why men great till they got to be great" kind of resonates with me somewhat. But by the same token, sexuality is a big part of relationships, and when that almost invariably is impacted by cancer treatment, it's super tough. And with some cancers, the impact on sexuality continues for years and years after initial diagnosis. So it's something that needs to be continuously addressed. I think that recognizing that there are specialists who deal with this problem too. So as a medical oncologist taking care of women with breast cancer, a lot of what I deal with has to do with sexuality. And so I feel reasonably comfortable with that. But we have a special clinic, sexuality, intimacy, and menopause at Yale, and that can be referred in from anywhere. And there are gynecologists and other providers who specializes in this. So just getting to know these people, because there's so much that we can do to help. But I think that the critical aspect is just making it part of the encounter, recognizing and giving people a chance to talk about how is sexuality impacting their life, and then just trying to dig in and help, because there are some problems which are really easy for us to solve, vaginal dryness being the biggest, and others are tougher. The interrelationship stuff, that's something that Tammy is probably much better at dealing with than my prescribing some topical estrogen.
Yes, absolutely. And Tammy, I'm going to come to you, but I want to go to Zarek. Zarek, what services do you offer? I know your organization offers a lot of great resources. I would love to kind of hear how you guys address sexuality and intimacy.
We have peer support, and that goes a long way. We have virtual support groups, in-person support groups, our navigation program, and we have a lot of educational resources available online. And so they can see it at the privacy of their home and really self-educate, and then bring that to their providers and their families and really kind of sift through that. We look at supporting the caregiver as well. Oftentimes they don't even know where to start, how to even start that conversation, and they need their own space to discuss what they're feeling and all of the nuances of their family member going through this diagnosis. So we really try to support that. But kind of going back to and tying this all together, I would love to see and challenge the healthcare system to making mental health a standard question, right? It's just part of standard care. And then with that, we'll force, like, like a clinic, like I always say, like if you have side effects from chemotherapy, you have a pill, you do nausea. And if you have mental health needs, then you have a prescription, and it goes to a navigator, it goes to a social worker, this automated system. So I foresee this being standard of care. So what Tracy was feeling isn't addressed on the later end, it's addressed right up front.
Yes, absolutely. Tracy, I want to ask you a question regarding this. Did anyone in you on your team ask you about your relationships when you were in clinic? Did any of your providers ask you about intimacy, sexuality?
No.
Okay. All right. And Tammy, I'm going to have you chime in.
Sure. So yeah, the interrelationship struggles, challenges, hurdles, supports. Um, some people like Tracy was saying, she and her sister became closer. Like so, there are we see a variety, right, of relationship dynamics at play. Something oftentimes is that one of the hurdles is body image and self-esteem, right, is
Mhm.
impacting the relationship. Someone surgical scars, radiation, right, all of these um you know treatments and such that do impact just the basic, like, this is how I feel now and I'm uncomfortable with that, or I'm feeling sensitive about it. I'm rocked, my self-esteem is rocked, right? um Sometimes there's also oftentimes just the emotional impact affects us physically too, right? And then oftentimes there's survivor guilt that is at play, just high levels of one worrying that this is going to come back, reoccurrence, impacting anxiety, then it's impacting the relationship and the dynamics at play. And really, sometimes just those feelings of isolation. I'm having trouble verbalizing what I need from you, as a partner, as a sister, as a mom, as a brother, and I can't really make it clear to you what I need from you. And then those people in our lives feel frustrated, feel shut out, feel discarded. They can't do anything right. I often hear caregivers say that I have so much guilt and shame. I can't get this right. So really something I work with clients that I'm working with is really about communication. Share, how can you share with someone, in your life, what you need from them, as you're working on your self-esteem, exploring how you're feeling in regard to these surgical scars, as someone wanting to have a sexual relationship, with your partner. And something else I just wanted to point out is something that we also often see also when dealing with younger people impacted by cancer is fertility issues. And so that is, when Dr. Fishback was saying some things are an easy fix, some things aren't, I immediately thought fertility, that's not such an easy fix, right? Even though we've come light years, from where we were, but it is still, and there's so much just as women that we feel in regard to fertility, and motherhood and that whole chapter, right? If we explore that. So there is a lot there.
Yeah, and I would love to ask. I think I know the answer, but I'm still going to ask. How many clients are you seeing that come in for couples therapy or counseling sessions, or is it usually just the patient? Are you seeing more couples or?
We do see couples. Typically, I work with individuals maybe around the issues, um, something I'm just thinking of, was someone who was sitting here in this room with me, really struggling with what to do post mastectomy. Her husband wanted her to go one way, she wanted to go another. It seems very straightforward, right? Like, well, do it. This is your body, your choice. Actually, there's so many dynamics at play in a marriage, in a relationship, in a friendship, so we do often explore those issues between couples, sometimes with both, sometimes with one.
Yeah, and I think it's important too, just and I know this is known, but prior to cancer, people have things going on, right? Like
Yeah.
like
Yeah.
they have stresses in their life. They may have, marital things they're kind of working through. So a cancer
Marriage
diagnosis.
is hard. Right,
Yes, it
add
is.
cancer to that, right? Right.
Yes,
Yeah.
absolutely,
Mhm.
absolutely. And before we get off the subject, I just want to talk about this a little bit. The LGBTQ community in Connecticut, who we're dealing with, early onset, a lot of younger people. What are you seeing in your practice? What are the barriers? What are some things we can do to help improve the support for the LGBTQ community? And
Well,
I'm gonna.
isolate. Oh,
Oh,
sorry.
go ahead. Go
I
ahead,
was just
Jenny.
going to say isolation. Talk about feeling isolated, right? So again, bringing people together who are experiencing something together, whether it be a support group or individual, and really um, bringing people together so people don't feel so alone.
Yeah, yeah. How about you, Dr. Fishback? What are you seeing in your clinic? Are you seeing anything?
Yeah, I think that this is a huge unmet need. I think that we do very little to specifically reach out to that community, and I know for myself, I would love to have more resources and training on what's the best way for me to approach the problem.
Yes, absolutely. How about you, Zarek? Anything to add?
Well, it's my responsibility as a patient navigator to understand the LGBTQI needs and the resources that are there. Although limited, Connecticut is the forefront of what this looks like. So we do have directories and such to support them. But just acknowledging, creating safe space, and finding those like practitioners. And the same happens with cultural and linguistic providers. Many people want to go to providers that represent them or that advocate or allies to them. So making it known is really quite important in medical practices now that they have that safe space to offer in order to address these, because that's where it really starts. If they don't even feel comfortable walking in to receive physical and mental health, that's where it all kind of crumbles. So it kind of goes back to what everyone deserves, a practitioner and a healthcare system that will listen to them. So it's now a matter of identifying it and knowing they're there so we can really best support the community.
Yeah, that is so key, creating that supportive environment so people feel comfortable,
Mhm.
just being open and real about what they need. Because, relationships and intimacy, for the LGBTQI, as you said, community, it can be very different. And I know, a prostate cancer gay gentleman who was supposed to be on the panel openly talked about the lack of intimacy following his prostate cancer diagnosis and treatment, which was very hard. But no one's really asking about it. So I think we as providers, and I know I saw your comment in the chat, Dr. Fishback, about oncologists are better. We still have more to do, but are better about asking about these things. So it's getting comfortable with the uncomfortable, so we can really serve our patients. And it makes me think of this holistic, patient-centered care. Are we really doing that? Are we really providing these personalized care plans for our survivors in Connecticut? So just some thoughts. I want to kind of go into reintegration and balance, and I want to bring it back to Tracy. I know you said you had to go back to work, but how was that reintegrating into the workspace? Along with treatment, cancer, all these things. How was that for you, and what challenges did you actually face in that reintegration phase?
Um, so it was really hard. I struggled with a lot of body pain. I struggled with neuropathy, especially in my feet, that I couldn't figure out what was going on with me. I
Mm,
still experienced a lot of fatigue, and things like that. Trying to work and then having still multiple things that just come up. I had trigger finger, I had De Quervain's tendinovitis. Like, it's just a lot of things, like always getting sick, um, because I work in healthcare. Even recently, I actually left a department at the facility I work in because there was a lot of discrimination as far as me always having to go to the doctor.
mm,
But I made sure I had things in place, but there's nothing I can do about that. So since then, I did experience some people who are more caring. I do and understanding, and then I do experience some people who think that I'm okay and I don't struggle with these everyday things, and that I can just do any and everything. And sometimes I have good days and sometimes I have bad ones. So I realized that I'm not a morning person. Like, I think that's my whole life though. So now I work like the second shift and overnight because my body needs that extra time to rest in the morning hours. So I'm still figuring it out. And it's still a struggle every day.
Yeah. What are some things you would tell if you had a leader from an organization here? Because, cancer is, I mean, the incidence is high, a lot more survivors in the workspace. What would you tell a CEO or organizational leader about, reintegrating a cancer survivor back into the work environment? What would you want them to hear?
I would want them to hear that um just because we are survivors doesn't mean that we still are not trying to survive through life altogether. We still have side effects that we deal with, sometimes years after the fact, especially from chemo and radiation. As far as neuropathy, that's something that won't go away. And just for them to be have a little compassion and understanding, and if a survivor is having a bad day, try to create a space where they can feel comfortable to come to you and talk to you, so you can understand and then say, hey, okay, today's not a good day. Well, maybe you can do this type of work instead of your normal work. Something like that.
Yeah, no, that's really good. I love that. Thank you so much. I'm
You're
sure they're
welcome.
listening. Yeah, so Dr. Fishbeck, I know many patients are not like Tracy that, they're going back to work, they have to, but how do you prepare patients to go back to work? Because they can have a little apprehension about, that's what I say in my clinic. I don't want to go back. I'm not comfortable, right? Because a lot of times you're dealing with the psychological impact of cancer, but how do you yourself prepare patients to get ready to go back to work?
Yeah. It's a great question, Chase. So first of all, it's always remarkable to me how few human resources departments have made this fundamental and well-published recognition that the better they are to their workforce, the better their workforce will be to them, especially in a climate where people are changing jobs all the time. So I really feel what you're going through, Tracy, because I hear all day, every day, people come and tell me they're worried about their job security. They can't do what their employer is asking them to do. They're being penalized as a result. They're afraid of losing their jobs. So first, just as Tracy did, I encourage people to make sure they have their FMLA paperwork in order, and social workers or navigators can help with that. Second, be aware of their legal rights. And we have some terrific, and I'm sure scattered on the state, pro bono legal advice that people can get about workplace discrimination, and that's very real, as well as housing discrimination. And Tracy, as you mentioned, being a breast cancer doc, also I recognize that you look totally normal, you are back at work, yet you are still living with your treatment and side effects of treatment, and that goes on for years. And how do you get accommodation for that and make people aware of it when they're just thrilled to see you back at work because you've been out for 3 months or something like that? And I don't think there's an easy answer to that. And I will only say that some bosses, workplaces are far more accommodating, and I think those businesses thrive, and some are not, and they are on the constant treadmill of changing employees. So I think that as a provider, I do try to always be filling out medical paperwork in such a way that people can have as much time as they feel like they need, fill out paperwork to allow for accommodations, air conditioning, air handling, being away from noisy space, maybe having climate be as they want. And regrettably, some employers choose to use their own physicians or make their own decisions and not accommodate, and that's really tough.
Yeah, no, thank you for that. Zurich, how do you help in terms of when you said paperwork? Dr. Fishbeck made me think of Zurich. How do you help patients really navigate that? Because that is a huge undertaking, especially when we're talking about patients who were, dealing with the psychological impact of stress and depression and anxiety. Now I have to get all this paperwork done by this time or else. How do you help patients kind of, you know, with the reintegration process?
Well, oftentimes the goal of navigators is to be proactive and not reactive. So we should
Mm,
be anticipating this for our patients. We should be educating them on the American with Disability Act to request accommodations. There are resources there that they can avail themselves of. Dr. Fishback mentioned legal. Um, in the chat box, I saw Cancer and Career is a wonderful resource. Triage Cancer has a legal navigation team that can do one-on-one sessions to discuss what your individual needs are. They can't represent you, but they can definitely educate you and lead you in the right direction. Many of our hospital institutions have this support through our social worker team. They're also doing the same, educating them. But oftentimes, yeah, it's so much for them. They're the ones sitting in the chemo chair. It's up to
mhm.
us, the healthcare system, to wrap our arms around them and try to foresee and help figure this out. They don't know what they don't know. And then when they're facing that, they oftentimes feel isolated. So what can we do to really get in front of that? And, and I don't put it all in the healthcare system. I put it on the community, right? It's our responsibility to take care of each other. So oftentimes it's navigators in the community setting, community health workers, or primary care physicians. They're also doing the good work of trying to figure this out. In healthcare, it's so big, but then it's just such a small world when you're sitting there with those side effects and those questions. So yeah, it's it's a lot of work, but it's a lot of good work that we're all prepared to do for each other.
Oh, I love that. I love that. And Tammy, I want you to chime in. What are the implications you're seeing in terms of that reintegration that I think a lot of employers don't see, right? Because they're not in the sessions. But what are some things you're seeing, like issues that patients are coming to you with in terms of that whole reintegration process?
Well, Tracy named two that I was thinking of right off the bat, right? So, um, yes, we survived, but now we're surviving the side effects. Like that was just so well put and
Mm,
just spot on, right? And also how I look to you on the outside doesn't reflect what I'm dealing with on the inside, or just under my clothes, quite frankly, right? Under my uniform in some cases. So um thinking of, sometimes some burns from radiation, for example, and I have to wear this uniform all day and it feels really uncomfortable, right? So sometimes just some concrete things like that, that we can, you know, just talk about, just figure out, like kind of like, bounce ideas off of, like how to cope with this, like just this problem. Um, and then there are the larger ones, the fatigue, that oftentimes people just feel like I'm not working the way in which I did before cancer. My concentration is impacted. I'm more sensitive to light and noise, brain fog. I'm tired. I really feel, I have so many people that say to me, thank goodness I work from home. Now, of course, not everyone has that luxury. Sometimes midday I take a nap because just the energy level is so different to what it was. Tracy spoke to it. She said, I figured out I'm not a morning person. Maybe that
mhm.
is who Tracy is as a person. Maybe that is someone that Tracy with, dealing with cancer and now survivorship, right? So we don't know, but she, swapped her shift, she said, right? But that also comes with other things, right? She, other feelings, but she's feeling fatigued at different times. So there's also just sometimes the physical limitations. Again, Tracy spoke about the neuropathy. And if I'm on my feet all day and I have neuropathy, on the bottom of my feet, or I drive a truck and now I can't feel the bottom of my foot. How is that impacting my work? Can I go back to work? So there are some, the re-entry to the workplace is wrought with a lot of issues. Some we can see and some we can't. So it's really great to have an important piece of someone's care is to have a safe place to talk about those things.
Yeah, absolutely. Thank you so much for that. Yep, go ahead, Zarek.
Just want to add that Tracy's our North Star, right? If Tracy didn't speak up, if she didn't say that, then how are the rest of us supposed to know that have that heart and that altruistic desire to be in healthcare? So I want to thank Tracy for doing that. But that also speaks to we have to become advocates. We have to empower each other and
Mm,
to be able to speak, right? We're talking now for those survivors in Connecticut, and we have to be on panels, on advocacy boards. We have to make it standard of care, but we can't do that if we didn't have Tracy as the North Star representing all the survivors. So thank you so much, Tracy.
I love that. Thank you.
Well
That's
said.
awesome. Yes, Tracy, thank you so much for being here and sharing your experiences. We really appreciate it. So, Dr. Fishback, can you just talk to us about the importance of addressing the psychosocial well-being and how it impacts overall recovery for cancer patients?
Yeah, so that's a big interest of mine. So I find it ironic and upsetting that our healthcare model is wait for illness to happen and then try to address it. So it strikes me that whenever you see the end of a tennis tournament or a basketball game, and there's the champion is hoisted up in the crowd, and who is the first person they thank after their parents is their mental health coach. And I think this is the model that we should have in cancer medicine. When you receive a cancer diagnosis, you should get a referral to a mental health professional because there are very real things that we can do to get our mind in the right space. Our mind is our most incredible muscle. It is our source of infinite power. And I think if we just develop some tools and structure, and I think that always blows me away when I'm on a panel with navigators, social workers, is just how simple and the things that these are tools that everybody can do that can really dramatically prevent a lot of the pitfalls that people fall into. So I think that being proactive again, making in America, we have a big problem with people view mental health as a weakness and something you do only if you have a problem and to do in secret, and trying to view it more as this is how we're going to harness this incredibly important part of your therapy by having this team member involved. I think that's the biggest shift that I would love to see.
Awesome. Thank you so much for that. Tracy, I'm going to bring it back to you. What's your outlook on life right now at this very moment, being a survivor in the state of Connecticut and representing all survivors on this panel? Like, what's your outlook right now?
Um, my outlook right now, from my personal perspective, I cannot wait to become an RN so I can therefore help, other survivors. That is my goal. I've been in healthcare for many years, and I can't wait to be more of an inspiration to other survivors or someone going through the treatment. That's my personal goal. But living in the state of Connecticut, I do not find that there's a lot of programs to help women or anyone with breast cancer to in the financial aspects, because Connecticut is rough. It's rough.
Mm,
And if you're not educated, and if you don't, you struggle. You struggle big time, especially if you're a single parent. I wasn't given the opportunity to I wasn't informed of fertility, like, maybe I could freeze my eggs because I was young. I was 34 when I was diagnosed. It was like, I was like, well, I'm not married, so I don't know if I'm going to have any more kids. And the option wasn't given. Just to educate women that they do have that option as well is really good. Just more education. That's all I can say, is just giving the knowledge and letting people know what's out there, and that they don't have to jump through hurdles and hoops and mountains just to find even the simplest information, because it really is hard. I mean, I'm keeping it together, but it would have been easier if I had like, a little bit more support or help.
Thank you for that. And
You're
now
welcome.
you're in the right place, Tracy. So if you need anything, you're in the right place. So
Okay.
definitely. All right. And we have about 10 minutes. And I do want to kind of just do like a round robin just for last words, anything you want to let our audience know before we wrap up. And then I'm going to end it with Tracy. I have one question for Tracy to kind of end our panel. And I'm going to start with Dr. Fishback. Any last words for our audience or viewers?
Yeah. Well, my last word would be that cancer changes us in profound ways, and there's a lot of negative, but there can be positive, and we can emerge after cancer. Tracy, the amount of good that you are going to do with that nursing degree is trying, and that is going to lead to just some incredibly profound, soulful change with you, and that is for me the joy of being a medical oncologist. And what I'd like to see in the future is just how are we assembling these resources? How are we getting the information directly into the hands of people so you can take advantage of these things?
Awesome. Thank you. Zarek?
I'd like to echo everything Dr. Fishback said, and then also turn around and support Dr. Fishback and those of us in mental health. There is a lot of emotional burden as well that the mental health providers have to endure. It's hard to hear these stories. It's hard to every day to sign up and do the good work. So we are ourselves in the healthcare field need mental health support, and it also has its own subset. I challenge all of us to become advocates, to be caregivers to each other, to our larger community, to speak loud at national levels, at local levels, and to be there, be present for each other. It really comes down to being good people, right? And just to be there for each other. So, in any capacity, whether large or small, we need to do that for each other. So, I look to do that for our North Star, but I also need to make sure that I'm doing it for our referral source, for our doctors, for our providers, and for myself. I oftentimes have felt exhaustion, did not go in and do any self care, even though I was advocating for it. So I definitely needed to draw upon our social work team to lead me and to guide me. So my North Star continues to be our Tracy, but I definitely look to our providers to help lead and guide us together.
Yeah, that's awesome. Thank you so much. And so important. And Tammy, last
Exactly.
words.
I think, put your oxygen mask on first before helping someone else, right? So it's really just that basic, if I'm acting as a container is what we call it in social work, and taking in what my clients are talking to me about, how am I caring for myself? But my big takeaway for today is really there is no reason to go at this alone. Um, and the feeling of isolation, we know that that's going to happen. And so it's easy to say, reach out. Well, that's hard to do, quite frankly. Reaching out, call me if you need anything is kind of empty, right? Because I'm putting it back on you to let me know what you need me to. So I really just encourage, please, whether it's, organizations like Cancer Support Community of Greater New York and Connecticut, or just other agencies, make referrals to professionally make referrals. So I could take that baton and say, hey, hey, Tracy, I got your name from, Dr. Fishback, and hey, we're talking and seems like you're dealing with this stuff, do you have some time to come in or chat, or is there a good time? Tracy works nights. What services are available, at a time that works for you? Hey, this is what we have. So sometimes meeting someone where they are, but meeting them there, truly meeting them there, not waiting for them to come to me first, is really a way that we can also decrease that isolation. And oftentimes our members are met with just that feeling of, oh, I can take a deep breath. That the weight off of my shoulders of figuring out who I'm supposed to call for what has just been taken off their plate. Talk about freeing. So that was one
Yeah,
of the
that's
takeaways.
a great point. We talk about advocacy all the time, but sometimes it's hard.
Yeah,
It's hard
it
to
is
be an
hard.
advocate. And we are going to close with Tracy. Tracy, what is one piece of advice you would give another survivor in navigating life after cancer? What's one piece of advice you would give that person listening to you right now?
Um, just don't give up. Keep fighting. Keep fighting. That's all I can ever say, because I have been fighting, and I'm not giving up. And I'm not
Mhm.
giving up until I can reach somebody and change their life with or without cancer. And I feel that that is my purpose, but just to keep on fighting and just keep, educating yourself on maybe opportunities or life after cancer. There's so much information out there that you got to know what fits you. You can't take it all in and think it's all you. You got to, you know, pick and pry about the information.
Awesome. Well, thank you so much. And my closing remarks are thank you to the panelists, thank you to the attendees. All of you did such an amazing job, such great information here. And I think I'm just going to end it with you are not alone. Just one phone call, one email to get connected to community to what you need. So thank you so much. And this recording will be sent out to you within 24 hours.